I hope that current members of Congress recall that it actually doesn't take a lot of courage to aid those who are already powerful, already comfortable, already influential. But it does require some courage to champion the vulnerable and the sick and the infirm, those who often have no access to the corridors of power. I hope they understand that courage means not simply doing what is politically expedient, but doing what they believe deep in their hearts is right.
That was former President Barack Obama last night after accepting the 2017 John F. Kennedy Profile in Courage Award at the JFK Library in Boston. It was the first time Obama weighed in on the health care debate, appealing to Congress to have the courage to stand up for the parts of the Affordable Care Act that have allowed millions of vulnerable Americans to receive health care. All but 20 House Republicans voted for the Republicans' affordable bill last Thursday. Those who did got an earful from their constituents this weekend in their home districts as details of the bill emerge, which will likely result in increased costs for the elderly and those with pre-existing conditions.
You are mandating people on Medicaid except dying. You are making a mandate.
No one wants anybody to die. You know, that line is so indefensible. Nobody dies because they don't have access to health care.
Yesterday, I was on ABC This Week with George Stephanopoulos and had this exchange with Republican strategist Sarah Fagan.
Everybody needs to take a deep breath on this, which is that we are through one part of the process.
Yeah, but Sarah, please tell somebody with a pre-existing condition to take a breath when they're fighting for their last breath. No. And when you say leave it,
not get rid of people with pre-existing conditions and put them in the dark.
When you say leave it up to the states, we saw what happened when these states did not expand Medicaid. When you saw the rural hospitals shut down in North Carolina, in Louisiana, in Mississippi, and I'm telling you right now, whether you're white and broke, black and broke, you live in rural America, you should be scared to death of this bill.
Many House Republicans say they didn't even read the bill, which is yet to be scored by the Congressional Budget Office. Stephanopoulos asked House Speaker Paul Ryan on his show about a 29 statement he made during the Affordable Care Act debate, in which he said no legislation should be rushed until lawmakers are able to read the bill, know its cost, and if it is scored.
I think this is kind of a bogus attack from the left. Let me say a couple of things. The bill's been online for 2 months. The bill has been in its final version for a long time. The final version was an amendment that was 3 pages long. It takes you 30 seconds to read. By the way, Obamacare was over 2,000 pages. This bill is under 200 pages. It doesn't take long to go through this bill. And the final amendment, 3 pages long. But more importantly, we got 2 CBO scores. And the most recent CBO score showed that we're perfectly in compliance with the Senate budget rules, which is what matters here.
But that's a flat-out lie. I mean, seriously, Paul Ryan, you want to keep saying it's an attack from the left. Those were your actual words. You actually said them on a liberal network. Members of the Senate say the House health care bill is DOA and they will start from scratch on a new one, even though White House Chief of Staff Reince Priebus yesterday insisted the Senate will make the House bill better.
Also going to have more options for people. They're going to have different levels of options for people. The pre-existing conditions are going to be
rolling back
down.
Medicaid.
The high-risk pools are
older people are going to end up paying 5 times as much or even more.
And by the way, that's the old bill. That's before. That
part of it
the
stays.
Amendments. But that's before the amendments were put in, and it's also before the Senate takes the bill and makes it even better, Chris.
Well, joining us via Skype from New Orleans, Dr. Corey A. Baer, CEO of Community Health TV, Chief Medical Editor at WDSU, the NBC affiliate there in New Orleans. So, Dr. A. Baer, first and foremost, when you look at this bill, your assessment of its impact?
Well, it's garbage. That's just plain and simple. I mean, basically what happened is that the Republicans took $1 trillion away from people that couldn't afford health care to begin with and gave it as a tax break. We know that people across the United States benefited from the Medicaid expansion, and the states that didn't expand, they didn't do as well. We know that. And so what you're looking at now is that, you know, they're leaving it up to the states. We know what happened last time when they left something up for the states, right? It was the Civil War. we can't leave this up to the states, because the states have other things that they may be trying to do, which really may not be trying to protect the least of our brethren. You understand what I'm saying? Because when they get a cold, we know black folks get the flu, and that's the way this is going to be. This bill has done so much to dismantle things that we've built. I mean, we're talking about maternity care, we're talking about preventive care, we're talking about prescription drugs, all these 10 benefits that Obamacare, or Affordable Care Act rather, made mandatory. This bill makes them not mandatory and leaves it up to the states. So, the women, older people, they're going to feel it the most, because with the old bill, with the Affordable Care Act, people over the age of 65 could only be charged 3 times as much for the same care. Now that's gone up to 5 times as much, and it has no cap. So that means that the people that really need health care the most are going to have some issues. And what we also know is with black folks, with the credit issue, if you go to the hospital and you can't afford it, then it will destroy your credit. And that's the last thing we need, is black folks not being able to buy houses because they had to go to the hospital to get their sugar checked, if you know what I'm saying.
Well, it's one of the points I made yesterday on ABC. We have seen bankruptcies fall by half as a result of the Affordable Care Act. It was a high of 1.5 million before the bill went into effect. It's now about 770,000. And bankruptcy attorneys say that is largely due to people not having to file bankruptcy due to health care costs.
That's right. That's absolutely right. I mean, and the thing about the states is that you're going to pay me now, pay me later, Roland, because this is the issue. If you get sick and you don't have preventive care, right, you're going to go to the ER anyway. And if you don't have money, the state is going to have to see you. And that's by the time you get to the ER because you're so sick, that's going to be tertiary care and surgery and an ER bill. And somebody's going to have to pay for that. The state has to pay for that. So if they do it at the beginning and give you preventive care, then we prevent all that stuff. So you're going to have to pay me either way. And if you pay me early, you don't have to pay me as much. But it's going to be a real issue. But I don't want people to get too alarmed yet, because I don't care what Reince Priebus has to say. This bill, when it gets to Senate, these senators, Republican senators, they're not trying to hear this. So I think that it's really going to be changed a lot if it goes through at all.
I actually disagree. I believe folks should be alarmed, because I'm not going to trust somebody to take a bad bill and make it slightly better. A bad bill made slightly better is still a bad bill.
I agree with that. I agree with that. I just I think that folks at this point, people gonna go out there. We know that if you get stressed out right now, which is an issue, if you get stressed out right now, you're gonna increase your cortisol level, and then you're gonna have a heart attack before we even know what's gonna happen. So I want people to be on alert. I don't want people to have a heart attack out there.
All right, then, Dr. Corey Hebert, I really appreciate it. Thank you so very much. Joining me now in the studio, A. Scott Bolden, attorney, legal analyst, former chair, D.C. Democratic Party, along with Victoria Burke, political analyst and writer for NBC Black, Eugene Craig, CEO, Eugene Craig Organization, and former head, what were you, vice chair or head of the Republican Party, in Maryland? All right, then, folks. So this is look, you go down the line. And I think, do we have the sound bite where I talked about AARP? Do we have that? Okay, so here's a piece. The number of groups who are opposing this: American Cancer Society, American Lung Association, March of Dimes, AARP, American Medical Association, so many patient advocate groups saying no mas, no mas. They say they want no part of this bill.
And these are the experts. And don't forget the hospitals, too. How can you have a good bill or a solid bill with that much opposition? And the Republicans just don't care. It's shameful, it's fraudulent, and there's no help in the Senate, really. Even if they start from scratch, there's still no help, because all they can do is create a bad bill, because these $900 billion in tax cuts over the next 10 to 12 years, and leaving it to the states, we know that the red states, we especially know the red states are going to opt out. There's no answer for this versus fixing
the places with the worst health care.
Right.
Eugene.
Look, 2010, the House flipped. America gave the Republicans the levers of power on the issue of Obamacare, on the issue of health care. I mean, the facts are the facts. When you have a third of the counties that have zero insurance, we have just here in the Maryland, D.C. area, Blue Cross Blue Shield are looking to have somewhere between a 40 to 60% premium increase because they're booking massive losses because of Obamacare. Where you're looking at people that legitimately cannot have, that do not have access, it's anecdotal, but it's real, live.
One second.
9 million real lives signed up for health care in January, right?
In reference to this current bill, I do think it's going to die in the Senate. Folk like Susan Collins and Rob Portman have already come out against the House bill.
Got it.
But more importantly, when it comes to the individual mandate and the employer mandate, we made a promise to the American public to get rid of those things. And that's what this bill
I know you want to ignore the millions of people who have signed up for the Obamacare bill, right? You want to ignore that because, of course, those people want health care. The Republican Party doesn't care about giving people, Paul Ryan and Reince Priebus throughout this entire process, they've never cared about covering anybody. And then they got trapped in, ooh, whoops, we got to have a bill. So they put this garbage out to say that they've got a bill. Totally ideological, totally about wanting to say you want tax cuts. And the adults in the Senate are probably going to, I think they're actually going to change the entire thing. Because the Republican Party can't run on this mess in 2018. They're going to lose the House over this, just in case you haven't noticed.
So when Warren Buffett comes out and says, this is nothing more than a massive tax break for guys like me. And so then when $880 billion is being taken out, and then for Secretary Tom Price to say, oh, no, this is going to be better.
They're just lying. I mean,
how?
They're lying.
So,
it's a straight lie.
So 1 second, how?
So a couple points here. First and foremost, Obamacare was laden with a whole bunch of surtaxes that just shouldn't have been there. Secondly, with the $880 billion, it's not a hard cut, it's a cut and increase. So instead of the federal
is this bill not a massive tax cut for the rich? Yes or no?
There are removal of the taxes that
or
placed.
No?
Absolutely. Their removal
absolutely means yes.
Yes.
Okay.
Yes, but this isn't a class warfare issue here.
I'm fascinated by this. How do you know this? There's no CBO score. Have you read the bill?
I've read parts of the bill.
Because I talked to 20 members who voted on that thing on Thursday who had not read the bill, Eugene.
I've spoken to members that read the bill.
They read the bill.
Congressman Justin Amash read the bill.
It wasn't posted in full, Eugene. It wasn't posted in full. Oh, really? Oh, really? He read it.
Absolutely. Absolutely.
Well, he went in that morning for caucus. He hadn't read it because we asked him to his face and he didn't confirm that he read it. Really? You talked to him before he went to the floor of the House. Well, he must have lied to you because he did not read the bill. They did not read this bill. They don't know what's in there, and they don't know how much.
Oh
yeah, well, yes, we are because we talked to him before he went into the
I'm going to say this. Congressman Amash read the bill.
Okay, he voted. So how much does the bill cost, Eugene? How much does the bill cost?
I don't know how much the bill costs.
Of course you don't.
The bill hasn't been scored yet.
Because there's no CBO score. And these people voted on a bill
but we also aren't going to tote the CBO as some golden standard, as if the CBO doesn't,
Hold on. How's the CBO not a golden standard when Speaker Paul Ryan was the one who said in 2009 we should not vote on a bill unless they scored? A peaceful protest turned deadly. 37-year-old black man was shot and killed by Baton Rouge police. Your hands are in the air, and you still get shot by the cops.
Oh my God, please don't tell me he's dead.
We're not gonna let hate define us.
Race is a big part of this.
If truly all lives matter, then all lives need to matter equally.
What we require is action. What we require is accountability. We understand that black lives do matter, and we will keep focused on this issue.
NewsOne Now, every weekday morning at 7 on TV1.